One branch which I did not mention to you in the previous segment was anterior superior alveolar artery. This is a branch of infraorbital artery. So we will mark exactly at this point. This infraorbital artery will supply anterior superior alveolar branches, which will supply the upper incisors and canine. Anterior superior alveolar branch. So we will mark this as anterior superior alveolar artery, which will supply canine and incisors of upper teeth, which is a branch of infraorbital artery. So with this, now we complete the maxillary artery. Now please note down maxillary vein. Now for maxillary vein, we will just draw here a small flow chart. We are going to draw here a small flow chart. For example, here in the center, if I make the square of maxillary vein, note down the points. Maxillary vein, the tributaries of maxillary vein will be the branches of maxillary artery. Whatever branches of maxillary artery, same the tributaries of maxillary vein. All of them join together at the posterior border of lateral pterygoid muscle. And together, when they join, they will form maxillary vein at the posterior border of lateral pterygoid. And this maxillary vein, if you recollect the parotid gland, will join with superficial temporal vein to develop into retromandibular vein. Therefore, if one mark question answer is asked or MCQs is asked, maxillary vein will represent which segment of maxillary artery, first, second or third? Maxillary vein will represent first segment of maxillary artery, because the tributaries of maxillary vein, by the time they drain, they will be present at the posterior and lower border of lateral pterygoid, from where the first segment of maxillary artery is present. At this level, there is formation of maxillary vein, and from there, this maxillary vein will pass within the parotid gland, where it joins with superficial temporal vein to form retromandibular vein. Now, communications, flow chart. This maxillary vein is connected with, superiorly it is connected through emissary veins to cavernous sinus. Same maxillary vein will be communicated antero-inferiorly to the facial vein through the deep facial veins. Same maxillary vein will communicate with the inferior ophthalmic vein through the inferior orbital fissure. Through inferior orbital fissure, the tributaries will connect maxillary vein with inferior ophthalmic vein. So therefore, this maxillary vein is now known as pterygoid venous plexus. The other name of this maxillary vein is known as pterygoid venous plexus, present on lateral pterygoid muscle. Both are one and the same. So therefore, if it is asked in one mark question answer, this pterygoid venous plexus will have communication with three structures. One, cavernous sinus through emissary veins. Two, facial vein through deep facial veins. And three, inferior orbital, inferior ophthalmic veins through inferior orbital fissure. Three communications of pterygoid venous sinus or maxillary vein. Here we finish our entire maxillary segment. Thank you very much.